Transcatheter aortic valve replacement with a balloon-expandable valve in low-risk patients. Definition: Transcatheter aortic valve replacement (TAVR) with a balloon-expandable device has emerged as an alternative to surgical aortic valve replacement for the treatment of severe aortic stenosis among patients who are at intermediate or high risk for death with surgery.
The heart's main function is to pump blood to the rest of your body. The heart contains four valves. Normal valves have two or three flaps of tissue called leaflets that open and close like gates to control the flow of blood through your heart. Aortic stenosis is a buildup of calcium on the aortic valve leaflets, which causes the leaflets to become stiff over time. This buildup reduces their ability to fully open and close, decreasing blood flow to the rest of your body. Aortic stenosis is usually caused over time as we age, but can also be caused by a birth defect, previous chest radiation, or rheumatic fever. Unlike other forms of heart disease that are caused by genetics, diet, or lifestyle, and can be managed by medications, aortic stenosis is a mechanical problem that cannot be prevented. It can only be effectively fixed by replacing your diseased valve. Aortic stenosis is a progressive disease, which means it gets worse over time. It's typically measured as mild, moderate, or severe aortic stenosis. As a result of the reduced blood flow, the body does not get the oxygen it needs, which may cause symptoms. Patients who have severe aortic stenosis could experience a variety of symptoms that may be confused with simply getting older, including shortness of breath, fatigue or feeling tired all the time, difficulty walking short distances or exercising, lightheadedness, dizziness or fainting, chest pain, swollen ankles and feet, and rapid or irregular heartbeat. Sometimes, when an irregular heartbeat or murmur is detected, it could be a sign of an underlying valve problem.
Applications in medicine: In patients with severe aortic stenosis who are at increased surgical risk, transcatheter aortic valve replacement with a balloon-expandable valves, in comparison with the surgical valve replacement, have significantly lower rates of rehospitalization after 1 year.
The transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. And here you see an aortic valve that's not opening well. It's severely calcified and the leaflet motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted in the femoral artery. It is threaded up through the aorta and around the aortic arch. And then that wire is passed through the stenotic aortic valve and placed in the left ventricle. Following that, a balloon catheter is passed over the wire into the stenotic aortic valve. The balloon catheter is then inflated, opening up the stenotic valve, cracking the plaque, and freeing up the leaflets. And that's in preparation for the stent valve or the transcatheter valve to be inserted. And the first rendition that you see is the first stage of the catheter going in, and then the second stage of the catheter coming through around the aortic arch over the wire, and it's going to insert into the stenotic valve. Once the catheter is placed in the valve, the stented valve is ballooned open, pushing the diseased leaflets out of the way and leaving a functioning aortic valve in place. And then the wire is removed, and you can see the leaflets of the aortic valve opening and closing, providing normal flow through the valve.
Pros and cons. Pros: patients have lower rates of new-onset atrial fibrillation and have shorter hospital stays. This type of valve has the advantage of having a more reliable centering and easy replacement, allowing more security during the procedure. It is a minimally invasive procedure, improves life quality and expectancy of patients with aortic stenosis. Cons: it is expensive and is not available in all hospitals.
The TAVR procedure, the transcatheter aortic valve replacement, is revolutionary in the fact that for the very first time, we can put this device in via a catheter. So for the very first time, a patient who needs an aortic valve replacement does not have to undergo major open heart surgery. We can put this device in using a catheter technique similar to an angiogram, similar to a stent. And for patients who are not good candidates for standard open heart procedures, this is a great alternative. So this is really revolutionary. It's a game changer. It's going to be changing the way we think about our patients and about the operative approach to patients.
This is an exciting time for tablet because we've now developed the technology in its third generation. The technique is very refined, and patients are receiving now excellent outcomes. Now we've evolved to low-risk patients with excellent technology and predictable outcomes.
Issue applied in Ecuador. It is a life-saving technique for people with aortic stenosis in which symptoms are threatening life. The clinical area, cardiology unit, and surgery area, cardiothoracic unit and the hemodynamic unit of the Hospital Teodoro Maldonado Carbo, since 2015 implemented a new procedure, transcatheter aortic valve replacement for aortic stenosis. Doctors in this hospital only have one type of valve for interventions with TAVR, which is the core valve with the diameters of 26, 29, and 31 millimeters, depending on the size of the aortic ring.
At first glance, this may look like a regular operating room, but this is much more. This is a hybrid operating room, a combination catheterization lab, interventional radiology suite, and operating room in one.
It allows us to do procedures that require imaging technology and may also require open surgical techniques.
Inside this room at St. Vincent's Riverside, physicians are the first, and as of September 2012, the only in the region to perform transcatheter aortic valve replacement therapy, or TAVR. St. Vincent's was hand selected by Edwards Life Sciences to offer patients this new, less invasive heart procedure, all who are too ill to undergo traditional open heart surgery.
If you have an inoperable aortic valve stenosis, then you really have about a 6 to 12 month mortality with very bad quality of life. And with this new procedure, it appears that the mortality, the longevity of the patient is much greater, and the quality of life, even more importantly, is much improved.
The brand new state-of-the-art surgical suite is 860 square feet, more than double the size of an average operating room. It had to be big to accommodate the multiple teams who work together to perform this unique procedure.
The team is made up of two surgeons, two interventional cardiologists, an echocardiographer, and an anesthesiologist, and then also the perfusionist and the assistants, the nurses and the techs.
Instead of making a large incision in the chest, the team makes a small one in the groin and inserts a catheter that is then guided to the heart. If open heart surgery is necessary, the open heart surgery team can jump right in without having to transport the patient. Everything is high tech, from the equipment to the monitors, even the bed.
This table goes up and down, left to right. You can position the patient any way you want to, but you can also bring in the x-ray machine and perform imaging studies at the same time that you're doing perhaps a surgical procedure in a different part of the patient.
The procedure comes with risks, but doctors are hopeful for most it will not only extend quality of life, but years too. Physicians say transcatheter aortic valve replacement therapy is revolutionizing cardiac care.
It's a great thing to have. It's a new advancement in technology and in patient care.
we now have one more tool in our armamentarium, things to offer them to hopefully extend quality of life.
Conclusion: patients with severe aortic stenosis with a low surgical risk, the rate of death, stroke, or rehospitalization after 1 year is significantly lower with TAVR than with surgery. Transcatheter aortic valve replacement as a treatment for aortic stenosis provides greater functional class of dyspnea and is also associated with the decreased hospital stay.
Many patients with aortic valve disease, like Ms. Frank, can be undiagnosed or have no symptoms until the disease becomes severe. Our population is aging. More patients are developing aortic stenosis as they age. We don't understand completely why aortic stenosis develops in a normal valve, but we are seeing an increased frequency. We know the risk of aortic stenosis with symptoms is actually very high for death. That approximately half the patients will die within 2 years if the aortic stenosis is not treated with a valve replacement. Medications are ineffective in altering the natural history of aortic stenosis.
Traditional therapy for aortic stenosis is surgical aortic valve replacement. What many people don't realize is that transcatheter aortic valve replacement, or TAVR for short, has also become a standard therapy for patients with aortic stenosis. During this procedure, the aortic valve is replaced with a valve that can be delivered remotely through the groin. It is different from surgical aortic valve replacement in that the native diseased valve is left in place and a new valve is placed on top of it, functionally replacing the valve. Because the procedure does not require cardiopulmonary bypass and the valve can be delivered remotely through the groin rather through a chest incision, patients can expect a very quick recovery after the procedure. Ms. Frank was an excellent candidate for TAVR. Currently, TAVR is indicated for intermediate and high-risk patients. For her particular case, she was a low-risk case, and with trials that are examining newer generation TAVR valves in low-risk patients, she came at the right time, the right place.
I had the TAVR on a Wednesday, and I was home on Friday. I had heart surgery, and it was too easy.
Ms. Frank did great after her TAVR procedure. Very short hospital stay and quick recovery.
Now she's back doing everything she was before TAVR and actually doing more things than she was a year or two prior to TAVR.
The people here at Northwestern were wonderful. They were very attentive. They took care of me. They made sure I was okay. I rang that bell, they were there.
If a patient is considering TAVR because they've been diagnosed with aortic stenosis, they should seek a center that does a large volume of these procedures and has expertise in taking care of these patients. The heart team is the most important aspect of a great outcome.
I'm definitely getting back to yoga. In fact, I have plans to become a yoga teacher.